All right, we'll get straight into our first topic now. Should we have to pay for NHS treatment? Get your calls in. That number again, 0207 862 2222. According to a poll by the Policy Exchange think tank, Brits consider access to GPs and good treatment for life-threatening diseases more important than cost-free healthcare. 61% said improving access to GPs, if they need one, was their biggest priority, while 44% said providing good treatment for life-threatening diseases such as cancer was most important to them. 41% believe providing all services free at the point of use should be the top priority, but that figure falls to a third amongst 18 to 34-year-olds. So, would you be prepared to pay if you knew you could access a GP or top quality life-saving treatments if and when you needed them? Albie, where do you stand on this?
Well, I am one such 18 to 34-year-old that very much falls into this demographic. I do think that there is no need for all NHS services to be free at the point of use. We do pay for the NHS, we pay for it through our taxation. We do indeed pay for some NHS services, things like dental care, things like eye care, things like prescriptions. We do already have a system in place where there is a framework of nominal co-payments most of the time compared to how much the NHS treatment actually costs, especially in dental care. There are bands, for example. And then if you can't afford those co-payments, they're means tested. I would not be opposed to that system being rolled out across the NHS.
So still means testing, meaning it would be free at the point of use for those that couldn't afford the nominal fees?
Exactly the same as dental care, exactly the same as eye care.
So we're looking after the most vulnerable, Kevin, in that scenario. What would be wrong with that?
Yeah, dental care is an absolute disaster zone with people unable to get NHS dentists because they've all gone over, or many of them have gone over to charging. You'd expect 18, 34-year-olds to be more relaxed about paying because they don't really use the NHS. I think if they go on in later life and develop conditions and require treatment, they may change their views. Albie's right, we do pay. We pay through taxation. I think that's a much better system. You have variations in the UK. For instance, you don't pay for prescriptions or hospital car parking in Wales or Scotland, but you do in England. But I just think that principle that treatment is free when you go to get it, you're paying your taxes, is a really good one we should defend. Because if you bring in charging and you're going to means test, which I understand the argument for it, you'll bring in a huge bureaucracy and then you will get what you have with winter fuel allowance where people are just a few quid over a level and they'll be hit with massive charges. I think it's much better. We put a lot of money in. We put a lot of money in with our taxes. I don't think we should pay twice over for treatment when you then turn up to a doctor or a hospital.
Should dental care and eye care be free at the point of use?
Yeah, I would like to revert them back to how they were. Yeah, I would. Dental care, everybody should have access to an NHS dentist if they want one. I think we should. Now, of course, you will have to spend on that. I accept that. But I think it would be a much better system because as we've seen with so many kids having poor teeth, it puts other costs on the NHS. If you had a better dental care system, you'd save on operations, for instance. And not only would those individuals have better lives, the public purse would benefit overall. You invest to save.
Just going back to the means testing thing, Kevin brought this up, Albie, but there is always that borderline just on top of wherever the threshold is that will really struggle. And is the problem with charging for the NHS that those in that band, for example, may be less likely or more reluctant to go to the GP, perhaps when really necessary, because they think, oh, I just can't afford that. Maybe it's not that bad. Maybe I'll wait another week or two to see whether these symptoms calm down. And that's not what we want in this country, is it?
I think there are enough clever people that work in the civil service, that work in the government to come up with a means testing system that works for the British people. We've managed to do it with eye care. We've managed to do it with dental care. We very rarely talk about this issue when it comes to eye care. I don't think we've ever had that debate before.
We do talk about it with dental care, though.
Perhaps with dental care, but the point is, for most people in the country, that is not an issue. Now, I appreciate there might be a minority of people that this would affect and they should be helped. But I don't think we shouldn't make the perfect the enemy of the good. And I think a system of means testing and co-payments would be much better than a system where we're just going to see our taxes raised perpetually because we have an ageing population that's getting more ill and a shrinking labour force. It's my generation that's paying the more taxes that are paying for everyone else's healthcare. And by the time I'm Kevin's age, the system will be much worse.
But Albie, that generation paid for the schools you went to, for your education. They paid for everything you had when you were younger, and then as you go through life,
Kevin,
and you're successful,
your generation,
and you earn, Albie,
your
and
generation,
you're earning, you then pay back. That's what you do. That's how we work.
Your generation will get a dividend from the state. You will actually get more in public services than you paid in through your taxation over the course of your lifetime. That will not be the same for my generation.
I'm quite well. I earn decently, so it won't be my case. But you're right. Many people do get more out of the system they pay in because you have progressive taxations. So those who earn the very most will pay more in tax than they will get out. But that's a civilised society. That's a democracy.
I didn't mean to make this a generational debate, but actually there might be, when it comes to the NHS, an element of that, because as Kevin said, if you're 18 to 35, you're probably accessing the NHS a little bit less, and it's more financially demanding on you if you're in your older years. Kathleen from Northumberland, would you mind paying maybe just a nominal fee for access to NHS treatment?
No, I would not. I definitely would not. You know, excuse me, I'm 78 now. I trained as a nurse when I was 17. I got very, very little pay then, right up until I was 40. And I think, no, I've paid into it. I'm a person that's an infrequent user of it, but as I've got older, I now have type 2 diabetes, so I need medication for that and have to go and see doctors regularly at the hospital. No, I shouldn't have to pay for it, and neither should anybody. What's happening with our money? There's more people coming into the country, and, you know, we're expanding. The government need to think of a better solution than the people paying.
Well, interestingly, a lot of the people coming into this country are coming into areas such as care and the NHS. So if we stop that happening, there may not be enough nurses and doctors in the NHS to treat you if you needed it, even whether you're paying it or not.
No, I didn't mean it that way. I just meant we are expanding, so the cost is more.
Okay, so you want to keep the population number the same? So that...
No, I didn't even say that.
Okay, but you're talking about population increases, so what do you want the population to do?
No, but I'm elderly. I'm on a pension, and as a nurse, I got very little pay in the 60s. So, you know, sometimes you've got to just reap the benefits when you get a bit older.
Kathleen, I think, to be honest, if this was to come in, I think that, as Albie said, there would be means testing. I don't think pensioners would have to pay, as I believe you don't pay for prescriptions.
Not yet, but it'll happen. It'll happen, mark my words.
Kathleen,
you know,
Kathleen, may I ask? You said you're a nurse. You presumably have an occupational pension, probably a small one. Do you still get your winter fuel allowance?
Do I get a winter fuel allowance?
Did you get your £300?
Yeah, I probably do, but that's got absolutely nothing at all to do with anything.
Yeah, I think you almost certainly don't. The reason I'm saying is...
Can I just finish what I'm going to say to you?
Yeah.
I worked in the 60s when nurses, I got very, very little pay and worked 12, 13-hour shifts.
Yes.
I worked in apprenticeship. I got little money. When I qualified, we still didn't get a very big salary. 13-hour shifts.
Kathleen, I don't think much has changed since then. I believe nurses still work 12 to 13-hour shifts, if not more than that. And in terms of how much they get paid, number-wise, it may be larger, but in terms of what they can afford to pay with that wage, it's probably not too far off, if indeed maybe less. Kathleen, thank you very much for your call, though. Lee from Cheltenham, what's your view when it comes to oh gosh, I've nearly forgotten what we're talking about, paying for the NHS?
I wouldn't personally, because basically I've been undergoing treatment with the NHS for the past, I think it's about 18 months now.
Okay.
It's not a life-threatening one, it's actually just an ankle injury. It's been going on for a long, long time.
Okay.
Now, I've been seeing 3 different doctors, and all 3 different doctors have diagnosed all things completely different, even though they work in the same service. Now, I've had to go private, and within sort of 20 minutes of being private, I actually got diagnosed as having a collapsed ankle with cartilage damage and also tendon damage. Now, my argument is with this, why would I pay for a service that can't diagnose me properly?
if you got a better service. Is that not the argument, Albie?
Yes, and I think, Lee, what you said there is interesting. You went private, you paid for it, you got a better service. And I think this is the crux. This is the crux of my argument, if you will, Lee. If you were to pay for NHS treatment, not a nominal fee, not as much as you're paying to go private, but it meant that the NHS treatment was better, surely that would be a better system than we have now, where you went to go and see 2 or 3 doctors, they gave you the wrong diagnosis, you then went to go pay privately a lot more than the payments I'm suggesting, and then you're in the situation that you are in now. Surely it's better to pay a nominal fee for NHS treatment, and then it's better for everyone.
No, I think what it is, it doesn't need to be a nominal fee. I don't think... basically, the nominal fee is paid through taxpayers' money. So what I think needs to happen at the moment is, I think there needs to be a restructure of where the funding goes in order to prevent the nominal fee being paid.
Are we talking about less managers here, Lee?
I'm talking about bringing back the NHS to the way it used to be, instead of going private for this, private for that, and private for everything else.
Okay. All right, bringing it all under the hands of the government. Okay, Lee, thank you very much. Beverly from London, what's your view?
Well, my view, I don't see why we should be paying for the national health. I worked 30 years there, and now I'm not well, and I can't see a doctor. I go to the hospital, and I wait 10 hours. And then when you see a doctor, there's no bed to admit you. It's a disgrace what the national health come to now. I mean, I work where we didn't have machine to lift. We had to lift bodily. I hurt my back. And now I'm in pain. Yeah. And you go to the hospital, you can't see nobody. You're there, the queue is there. It's a disgrace. I can tell you what's going
Beverly,
on. It really hurts.
Pain is such a complicated thing as well to have to deal with. But if, Beverly, if we lived in a situation where paying a bit more every time you use the NHS, because we pay for it anyway in our taxes, but to use it, so those that use it pay more. If you had to pay every time you used it, you were guaranteed better service. You were guaranteed to see that GP when you needed to see them. You were guaranteed to get that pain medication when you needed that pain medication. Would you not be willing to pay for that?
No, that's rubbish. Before that, I'd rather go private. No, I don't believe the national health should be private, because we work in there, we stress ourselves out, work how much hours with a little pay, and now we come to the crunch that you need help and you can't get help. No.
Beverly.
The national health shouldn't be private.
Okay, thank you for your call. Yulie from Lincolnshire, paying every time you go to the NHS, does that seem reasonable?
Of course not. I mean, I'm 78, like one of the previous caller, and I have worked and paid into the system through taxes and national insurance. And I'll give you an example. Like TV license started off at £5 when you start paying. How much is it now? Now, for myself, I try to see whether I can get help. I've got like spinal stenosis and all those things, and I have to keep warm. Now, I don't get, I don't qualify for anything. Whenever I apply for any benefit whatsoever, I'm just that little bit above the line, so I get nothing. Now, once the NHS, I mean, most of it is privatized anyway, subcontracted. So therefore, I can see that moving towards that. But it's okay for some people to say, yes, I'll pay. But you start paying a small amount, and before you know it, it's a lot. Do people know how much it costs for an MRI scan, an operation, cancer treatment and all that? What would poorer people do?
I do wonder sometimes whether the NHS should just give you a bill at the end of, not that you have to pay for it, but just a bill so you fully understand how much your taxes have paid for, and so we can, I suppose, respect the work that the NHS do, because we go in for a quick scan and we think nothing of it because they don't charge us, but actually each one of those scans costs hundreds and hundreds of pounds.
I think if you had a computer program that could produce that very quickly and cheaply, yes, but if somebody had to be employed to work it all out, no, I'd rather have a nurse, a doctor, or another specialist.
That's a very fair point, Kevin, absolutely. And that's why we do debate shows. Yulie, thank you very much for your call. Thanks for all your calls and insights into that one. Don't forget, later we are asking...